Welcome back to the Island Docs. We're here with Dr. Adams discussing depression. So, Dr. Adams, before we went to break, you were telling us about gestalt therapy. Care to elaborate a bit?
Yes, gestalt therapy is an existential therapy that comes out of a belief that the word gestalt itself means whole in German. And so it comes out of the belief that people are seeking wholeness. And wholeness means that there has to be an integration of our mind, our body, and our spirit. There are some key factors that go with Gestalt. So the Gestalt therapist is trained to help clients stay in the here and now, unlike psychoanalysis that starts at the very beginning and comes forward. The Gestalt therapist stays in the here and now. Another very important component is awareness. The Gestalt therapist is very keyed and exquisitely aware of how people use their bodies, because we believe that our bodies have a language unto themselves. And by me connecting your thoughts with movement of the body and bringing it to your awareness, that in itself is healing. So for instance, I'm talking to you and you are doing your head. Now I would want to know from you, are you nodding your head in agreement? Are you nodding your head to let me know that you hear me? And I would pose that question to you. The other very key aspect of Gestalt therapy is the phenomenological approach. And it means that a Gestalt therapist believes that the client is the author of their own fate, that you are your own expert. And my job here is to co-journey with you to help you discover the pieces of yourself that might have been cut off or disconnected through awareness, through attention to mind, body, and spirit.
Oh, fascinating stuff. Fascinating stuff.
Wow, wow.
I mean, my other question to you is about depression has been linked to addiction. There are so many people who are substance abusing as a means to cope with their depression. In your experience, tell us how has this been shown?
Well, I think there's a very, very definitive relationship between addiction and depression for two reasons. One, some of the drugs that people use cause depression. So even if they weren't depressed by constant use of alcohol, right? If constant use of crack cocaine, once you come down off the high, you're going to hit a bottom, and that's going to be depression. So that exacerbates what was already there. The second piece is that, in my experience, most, if not all of the clients, and this is thousands now because I've been doing this a very long time, have had a heartbreak or a trauma or a hurt or a wound that's so deep that addiction was a way to comfort. It was a way to medicate. It was a way to anesthetize. And it became part of the coping strategy. They didn't think that they would become addicted. It was a momentary response to an inner hurt. But we know that addiction, one, is not enough, right? And so once people get started, they can't stop. The other thing is that there's a brand of addictions called process addictions. Those are not substance addictions. That's the shopping, that's the sex addiction, that's the internet addiction, that's the gambling addiction. And all of those are responses to, I want to be distracted from what is my central and core issue. And the addiction by itself becomes an issue. And so now the person is battling addiction and may never get to the core. And so good drug programs or good substance abuse programs are programs that integrate therapy along with recovery from addiction as part of their treatment regime.
Well, that's some fascinating stuff,
Yeah,
tying
definitely.
depression and addiction. On our next segment, next episode on the Island Docs, we will be addressing addiction in a deeper sense so that we can really understand what constitutes addiction and how to treat addiction. Thank you, Dr. Adam, for coming to our show and giving us that insightful information about depression and addiction. And you folks out there, don't forget, if you have any questions or concerns, you can email us at theislanddocs@gmail.com. Don't forget to like us on Facebook. And the apple for today is, if you are having depressive symptoms, or if you're feeling very, very sad or depressed, do not be afraid to seek help. Don't be afraid. See you next time. Have a good one.